Greetings, everybody. Thanks for joining us tonight. I'm Terry Minow, chair of Big Sky 55 Plus. I grew up on a ranch south of Miles City, went to college, and taught Head Start in Missoula. I was the political director of MEA MFT, now Montana Federation of Public Employees, and I'm a founding member of the Big Sky 55 Plus Board of Directors. I ranch with my family in the Boulder Valley south of Helena. Big Sky 55 Plus was founded to give Montana's older people a strong voice in deliberations about our state's future. We bring people together to work for solutions that make life better for Montanans of all ages. We have had remarkable success, passing good bills and killing bad bills, holding lawmakers accountable, and electing those who will work for the common good. We also sponsor fun, inspiring events like last summer's Whistle Stop Tour for Social Security and last spring's Gathering Wisdom, Building Power Conference. You are invited to join us. Please sign up to join Big Sky 55 Plus on the link in the chat, and we will have that link in the chat. Tonight's theme is Healthy Futures, Saving Montana Medicaid. Our dynamic and distinguished speakers are Cherie Taylor, Dr. Lauren Wilson, Senator Cora Neumann, and Representative S.J. Howell. I'm so excited to hear from them. After each one speaks, they will answer your questions. This town hall is 1 hour long, so we have to keep things moving right along. Please go to the bottom of your screen to the Q&A button to post your questions. I will ask them as time allows, and we are recording this town hall meeting for later playback. Let's get started. Cherie Taylor is president of Logan Health Cut Bank, a 20-bed critical access hospital that serves Glacier County, one of the counties with the largest percentage of residents enrolled in Medicaid. Taylor has been with the hospital, formerly known as Northern Rockies Medical Center, for 25 years. Cherie.
Thank you, Terry. I appreciate having the opportunity to really speak on this important matter for rural healthcare. Back in 2015, when the HELP Act passed, I don't think any of us knew how this was going to turn out for Montana. And it was a Montana-made program that really did lend a hand up instead of a handout, sorry. And so we did see that through the past 10 years, the creative solution made by Montanans for Montanans has really worked. In my organization, what you can really see is that all of our services with people who are enrolled through Medicaid, through that HELP Act, is about 27% of all of our services that we provide for everybody. And that equates to about $2.5 million. And that's out of about a 13 million gross. And so it has a tremendous impact on the organizations. I've told the story before a few times, but prior to the HELP Act, it wasn't that we didn't have patients to take care of and meet their needs. We just had a high level of uncompensated care, and several times our business communities had to step up, and they stepped up and co-signed loans for our organization in order to keep the doors open. And at one point, the community and business leaders stepped up and actually gave us the loans to the tune of $500,000. And people say, well, how come that's important? I asked one of the business people and I said, why would you do that? Why would you put your business on the line? Why would you do your own business co-sign for us? And they said, Cherie, you have no idea how important healthcare is in the rural areas. If we don't have healthcare in the rural areas, we don't have workforce. And we also lose our workforce out of the community. And so we can't produce as much and do as much work as we can while everyone stays healthy and is here. So they said it's extremely important to us. And we found that, 15% of Glacier County is enrolled in this program, but that has come down. It used to be about 18%. It was 17.8. And so the stories that we are hearing is how people are usually on it less than 24 months. And that's what we are finding too. But the benefit to all of this is now that we're being reimbursed for the amount of care that we're providing, we're able to expand in areas that we were never able to even consider before. And so one of those areas that we expanded in was behavioral health services. And we started that behavioral health service, and today, now we have that service for not just the people who are in Medicaid, but we have it for those in the commercial markets and other payers too. And so, yes, 34% of people enrolled with Medicaid expansion do receive services of behavioral health and mental health, but 43% are on the commercial side. So what I say is this is important to everyone, whether people are on Medicaid or not, because these services are able to be offered to everyone. And if that uncompensated care gets too high and we can't provide the services, then everybody in the community loses the services. And that is devastating. And so I have just been really amazed to kind of hear the impact that it has. You know, we have seen that businesses have told me that they can do more, build more, be able to continue to expand and find more workers, because about 46.8% of our businesses in Glacier County have at least one person that's enrolled. And typically what you find is these are not people on full-time, they are part-time. So they can also now contribute, whereas before they would have to do something else, but they do have healthcare through this source and they can work. And then what we typically have heard and found is that people will go from that part-time status, things will change in their life, and then they can go on to full-time and usually get commercial insurance. So I think it's really important for us to really focus on the facts. Sometimes there is a lot of conversation about things that are not true about this HELP Act and what Montana has put in place. And so people are like, this is unaffordable. The state of Montana can't afford it. And what I will say, in my opinion, is the state of Montana cannot afford to do this. It would devastate our general fund. And it, you know, right now we are able to bring funds in order to pay for this compensation of care in the state of Montana for these enrollees. And it's only costing the state 4%. So we have outside sources, including hospitals and others, providing the other 6% for that piece. And then, of course, it's a 90% match from the federal government. Well, people will say, well, Cherie, that's taxes. It is taxes. But what it was a budget neutral program when they put it in at the federal level. It had to be. And so actually what the issue was is they decreased the payments to the hospitals for what they used to get reimbursed for providing services. And then if you expanded to a larger population, you were able to get that money back that you used to be in reimbursed. And so what it did was it provided greater coverage for a larger population, and with the intent that if we provide these services, then people can get preventative services. They don't have to go to the ERs and do expensive care through inpatient. And that is really important. And we've seen it. There for a while, we had our inpatients and ER kind of go up, but then we really saw some drops in that because people were able to go to the clinics and other areas that were preventative and upfront, and they were able to get their needs covered before it was critical and costed all of us. People said to me, Cherie, this is an entitled program. I said, we've had entitlement through the ER. We have to provide services to anyone in the ER that comes in, no matter what. But at what cost? It is great cost to the patient and to our local communities and to our state when we have these catastrophic conditions that could have been prevented if they would have went into clinic and other preventative services prior to being through the ER. And so for me, this is a huge savings for Montana. It's a huge savings for people's health and welfare. And also it is a huge economic driver for businesses and workforce. And all of us need workforce. And so for me, it's just unimaginable that we would not continue to move forward with something that Montana has put together. Our state is one of the best performers with this program. And so I think that we need to continue to refine it, yes, to do a better job, yes, but let's not throw it out so that it ends up costing Montana and the well-being of Montana more so.
Thank you, Cherie. So I have a couple questions for you. Our first question is, do you have a story about how Medicaid expansion helped?
Sorry, did I?
I can't hear anything. It cut out for me.
I think that Terry's computer rural internet kicked in here. So I think it was how Medicare expansion got through. I don't have that question in front of me. Lila, do you have that?
I think I see that it was a story about how Medicaid expansion helped people in our community. And
Yeah, and you
I'd be happy to
really
answer
did,
that.
yeah.
Okay, yeah.
Yeah, go ahead.
So I have a story. So we have patients come up to me and said, Cherie, you have to keep behavioral health. And I want to tell you a story. And I'm like, okay, happy to hear it. I never wanted to not have it, but the issue is when you're trying to keep your doors open, you're not looking at expanding services like that. And so they said, here's why it's so important that you have this, and really what Medicaid expansion did for me. My young children were on some different state programs. I was not well enough to work. And so our family struggled. And so the rest of the family did not have any coverage. Through Medicaid expansion, I was able to get covered. And because you were able to have a behavioral health program, it helped me so that I could go back to work full time. And now I'm working in healthcare and have commercial insurance for our entire family. It's changed our life, right? And so I just think stories like that are really awesome. And I hear them time after time. You're walking down the street and they're like, I need to tell you my story. And what I also found interesting is some stories, as soon as I heard about their story, I'm like, oh, well, they were on, you're on Medicaid expansion. Like, no, I was. When I started telling you my story, I was. And now I'm working at a different place where I have full coverage through commercial. So it's amazing. The stats that we see, I hear in real life from individuals telling me about the care that they received.
That's great. Cherie, another question is, how would your facility be able to survive financially if Medicaid was not extended by the legislature? That's a pretty harsh question, but.
Yeah, so it would dramatically be impacted. And what I have found is that when our team looked at this, when I told you about that 2.5 million, it would put 37.5% of our employees at risk. And it would be pretty traumatic. We would have to cut out major service lines. And again, I come back to, this is not just about people who are enrolled through the HELP Act and Medicaid. This is about our whole community would lose those service lines and would be a huge impact.
Thank you. Thank you, Cherie. Medicaid is crucial to both our urban and rural communities and hospitals. Thank you so much for bringing these stories to the legislature and to all of us.
You bet. Thank you.
Dr. Lauren Wilson is a pediatrician in Missoula and the immediate past president of the Montana chapter of the American Academy of Pediatrics, AAP. She advocates for child well-being in Montana, including family support in early childhood, access to health care, and food security. Nationally, she serves as a member of the AAP's Committee on State Government Affairs. Dr. Wilson.
Hey everyone, I'm really glad to be here. You might think it's a little strange to have a pediatrician talk about a program that primarily serves adults, but I think it actually shows a lot of the ripple effects on the health of our communities and our families to examine Medicaid expansion from that lens. So first, a couple of definitions, just because I'm not sure, I think a lot of people here know a lot about Medicaid, but it is complicated. We have traditional Medicaid that's been in place since the 60s. That covers a lot of Montanans. We also have the CHIP program, which is Healthy Montana Kids, which has been around since 1997, that covers children kind of above and beyond what traditional Medicaid covers. So kids, families with kids, they can get coverage even if they earn a little bit more than what would typically qualify them for traditional Medicaid. And then Medicaid expansion, which the focus is on this session, is an extension to Medicaid coverage that targets adults that are 19 to 64 who make up to 138% of the federal poverty level. And that covers around 75,000 adults in Montana. And that number fluctuates a little bit from month to month. But the reason that Medicaid expansion is something that pediatricians have engaged with so much are the ripple effects that it has if parents are healthy, if parents have coverage, and what that means for their kids. So just a couple of kind of set the stage. When we see expansions of Medicaid, so Montana expanded Medicaid first in 2015. A lot of states did that around the same time. Some have followed suit more recently. Looking at what effect that has on the population, we see that more people get prenatal care, more people get postpartum care. If adults and families, adults in a family get coverage, then the children are also more likely to get coverage, even if they were eligible before, just that the parents are going through the process of getting themselves coverage, they're newly eligible. They might not have realized that their kids are eligible for coverage. And so that brings more kids in for preventive care. And investing in preventive care for children is one of the best investments a society can make, in my opinion, and numerically. Kids have better health outcomes. They have benefits well into adulthood. We also know that a lot of what Medicaid expansion did was to help areas of the healthcare system that traditionally are not moneymakers, but are really, really important. So we saw that the number of substance use disorder treatment facilities in Montana went up dramatically after Medicaid expansion. And I can tell you, when parents are struggling with substance use, they can't really be present for their kids in the same way. And when they can get into treatment, that's probably one of the most life-changing things that can happen to kids and families that I take care of. So seeing parents get treatment for substance use, seeing them get mental health treatment, that's another thing that expanded greatly after 2015 when we had expansion in Montana. We saw immediate effects on kids. And we know in the expansion population, about 44%, or actually just in the general Medicaid population, about 44% of people have children. And just bringing financial stability to a household, if you don't have to worry about medical debts, if you don't have to worry about your family being bankrupted by an ER visit, your stress level goes down. And we actually see less child neglect and better CPS outcomes in states that expanded Medicaid versus states that did not. And then just for another minute, I want to throw in a kind of more recent event. You might have heard in the news about unwinding our Medicaid reauthorization. At the end of the public health emergency, so last year in the spring, our Department of Public Health and Human Services actually had everyone kind of re-enroll or prove that they needed to be enrolled again in Medicaid. And that is because they weren't allowed to do that during the public health emergency. And then, they basically sent packets to everyone and said, let's reapply. Let's make sure that you're still eligible. We saw in Montana, 36,000 kids lose coverage through that. And a lot of it was just barriers. It was barriers about having, forms that were not written in ways that people understood, having guardians who weren't in a position to fill out the form, having adults who maybe thought that because they weren't eligible, their kids weren't eligible, forms being sent to the wrong address, people sending them back and not having them received. We had a lot of just barriers that were, people can't get into an OPA office. We only have 17 or 19 in Montana. We closed more than half of our Office of Public Assistance where people can go to get help with these applications in 2017. So there are a lot of barriers to people re-enrolling. And I saw as a pediatrician, a lot of kids lose coverage and not be able to afford their asthma medications, not be able to keep tabs on chronic disease. And we see people who have to go to the emergency room when otherwise things were well controlled and they were getting regular visits with their doctors. So I think we had a little bit of a preview last year of what it might look like if a lot of people lose insurance coverage. And I can say, the quality of life for those patients I know of who lost coverage was greatly reduced. And so I am a strong advocate for Medicaid expansion continuing, and I hope that we can move to lift the sunset off of Medicaid expansion this year, this legislative session, so that we can have coverage continue for those 75,000 Montanans who are currently covered by the program.
Thank you so much, Dr. Wilson. Here's our first question for you. Have you seen the impact of Medicaid expansion on your patients and their families? And I think you already talked about that, but maybe just give us another example of how that is a ripple effect on the family.
Sure. I take care of hospitalized children, and one person that immediately comes to mind is I had a child who was in the hospital, and the parent next to them was just clearly in a lot of pain. And I was like, what's going on with you? And they had a toothache and had not been able to go to a dentist in a very, very long time. And we had actually been working out some benefits and WIC and food aid eligibility for the child. So I had someone with the hospital come up and help and see if they might be eligible to enroll in Medicaid expansion. And they actually were. And they got to go, actually a family medicine doctor I was working with got them an appointment with the dentist, and they got to go to the dentist for the first time in several years and get a lot taken care of. And just the relief of being able to get basic preventive dental care was huge. So that sticks in my mind a lot, but it's night and day for some people.
So what happens, this is a question maybe for all of you, but what happens if Montana passes this and it's not funded on the federal level? Maybe talk a little bit about why you think it's important for Montana to fight for this despite what's going on at the federal level.
I'm happy to jump in a little bit.
Sure.
So there, Montana did put in their bill that if something changed, and the legislature would have to come back and relook at it and decide what made sense for Montana. So I think it doesn't matter what happens at the federal level. We need to continue moving forward. And I'm with Dr. Wilson. We really have proven that this program does work and works well in Montana. And so the sunset needs to come off. Another reason for the sunset to come off is because the legislature always has that ability to look at what is the federal government doing, what are we willing to put as appropriations, and deal with it at that level. So I believe we have all the safety mechanisms in place for Montana to move forward and then adjust according to what happens federally.
Great, thank you. And so Dr. Wilson, you might talk a little bit too about how doctors have been involved in, it looks like your organization has been involved in supporting this, and that's really wonderful because I know it's really hard to get time away from your work and to appear or to spread the good word. So, and yeah, there we go, thanks.
Sure. Yeah, I can say that doctors of all specialties and various professional organizations, even across the spectrum of political beliefs, have really been supportive of Montana expanding Medicaid. And that support has only gotten stronger over time as we've seen kind of before our eyes what happens with the fact that people are able to get care for chronic diseases, the fact that our rural hospitals in Montana are not closing, and states that didn't expand Medicaid are seeing rural hospital closures, and having that direct comparison play out state by state has really shown us that this policy choice is something that is helping our patients here in Montana. So the Montana Medical Association, the pediatricians, Montana Academy of Family Physicians, all of us are really unified in supporting Medicaid expansion. And we've been learning to be active at the legislative level so that we can tell our stories.
That's great. Well, thank you so much, Dr. Wilson. We really appreciate your good work on behalf of all that our children and families need to thrive. Everyone, please remember to post your questions in the Q&A box at the bottom of your screen. We have some questions that have come in that we'll be asking as we go along, but we would love more questions too. State Senator Cora Neumann serves as Chief Health Officer at the Native American Development Corporation. She has designed strategies and brought together local, indigenous, and national leaders to deliver quality, accessible health care and social services to underserved communities. Senator Neumann.
Thank you all so much for having me. And I just want to thank you all for supporting those of us that are in the legislature. It's invaluable. We definitely can't do it without you. It's teamwork. It is a team. You're all on our team. Lauren we're, as you said, so grateful that she's able to take time to be at the Capitol with us. And so it's been, of course, as it always is, this is my first session. I'm from Gallatin County. I represent Southern Bozeman, all the way down through Big Sky to West Yellowstone and then a little bit of Madison County. And I am in the legislature because my work is in rural health. And so keeping rural hospitals open is very personal to me because of loss we've had in my own family and the challenges I see so many of our fellow Montanans facing. And so really this is the heart of what drives me to run for office and to serve, both in my day job and in the legislature. My work with the Native American Development Corporation, if you're not familiar with it, it's based in Billings. And we run an urban Indian health clinic and serve tribal members, but also non-tribal members that are living in urban areas. And so, yeah, I don't know how much more you want me to share about my background, but that's, I've been a huge fan of Big Sky 55 Plus since I first was introduced to it. So you do some of the best work in Montana.
Well, thank you so much, Cora. I really appreciate that. So what was the effect that you saw of medication expansion on the programs that you work with, and how has that affected underserved communities in Montana?
Yeah, so as I'll just, I won't repeat what some of the things that Dr. Wilson said that were so great and spot on and really do also apply to Native communities. But what we see, so I don't, if you're familiar with the Indian Health Service, and I know Cherie, Dr. Taylor is also familiar with the communities that I serve. But so the Indian Health Service funds tribal health. It is about each Native American gets about a third of the funding that a non-Native American gets, and generally, I guess white, but just non-Native person gets through federal funding in the United States. So the funding for healthcare for Native Americans in this country the baseline is very low and is way too low. And even with major boosts and some, budget increases under the Biden administration, it still falls really, really short. And so Medicaid expansion was a huge boost for Native communities. Tribal, and you can access tribal health when you're on the reservation, but when you're anywhere else in Montana, and you have an emergency or you need care or you're working in an urban area, you need coverage. And Medicaid expansion was hugely beneficial, and not only boosted obviously access to care, but it helped all of the, like our center, the Billings Urban Indian Health and Wellness Clinic. It helped bring in critical third party payer, a payer source, so that we could not do just life or limb. If you've ever, heard people talk about life or limb coverage with that through the Indian Health Service, you can really get the absolute bare minimum covered because the funding is so low. And so with Medicaid expansion, we were able to expand programs that were really community-led interventions. So Dr. Wilson talked about the increase in substance use disorder treatment. That's a huge challenge facing Native and rural communities in Montana. And not only did it increase resources and bring in more providers or help more providers provide care, but it also helped us provide the wraparound services. And so that is really, if anyone works in addiction, mental health, and recovery, it's not just, can I go in and see a doctor? It's also, can I receive help getting my life on track, right? So that could be finding your birth certificate so that you can apply for the, public services so that you can get a job, get a driver's license, skills building for potentially, for applying for work and getting the support through that process. And so because we had Medicaid expansion and we're able to have not just life or limb services at our clinic, we were able to expand out programs that not only helped people, get health care, it helped improve their lives and helped create a number of local leaders, right? It supported local leadership and local community leadership where we were able to be more intimately involved with finding and engaging the community and bringing them in to help form and run programming. The best programming, I think one of my key values and just frameworks for how I work is that I believe that the best solutions come from the community themselves, right? If you want to know how to help a community, you ask people what they need and you ask them what they think they can do to fix it. You don't come in with outside ideas. And so being able to expand services and really engage the community lifted the whole community up. And I also want to really underscore the point of how it doesn't just help people on Medicaid. And I try to make this point all the time in the legislature. This is not just helping Medicaid recipients. This is helping everyone. Every single Montanan has better hospitals. Every rural community that has a hospital has that hospital still open because of Medicaid expansion. This is not just for Medicaid recipients. Like, I just want to say that over and over and over again. This is for the entire health infrastructure of Montana. And so what we've experienced since Medicaid unwinding, which Dr. Wilson outlined really well, it's been, devastating, the unenrollment or disenrollment rates. But we see, people foregoing care, right? And we could talk about that for a long time, but, in some of the families we serve, intergenerational, the grandmothers and great grandmothers won't go in to get care because there isn't enough money to pay and to cover without Medicaid. And so people are foregoing care. What happens then is that they get really sick, they go to the ER, and it's just coming out of a different pot. So I could really talk forever about this. I think we all could, but what I can say that we've seen that's been so wonderful is that ability to go beyond life and limb and really help empower and strengthen communities. And we've seen with the unwinding just how quickly that can go away, and how critical it is that we fix the system and also renew Medicaid expansion. So happy to answer questions, but I'm proud of the work that leaders like Representative Howell have been at the forefront of this since the beginning, and have been able to build the alliances we need to keep moving this forward.
Great. It's interesting, the theme that runs through all of this is kind of that it's not just for the people on Medicaid, it's for communities and families and business and for all Montana hospitals. So I really appreciate that theme that runs through all that you're talking about. If there's all these great stories and all the strong data that shows that Medicaid expansion is good for Montanans, why is there such a fight about it in the legislature? And I know that's kind of a tough question. I'll ask Howell that same question. But what are the responses that you get from legislators who are reluctant to fund it? And how do you respond?
Are you asking me?
I'm asking you.
Okay, I was thinking that was actually a question I think was going to be for maybe for Representative Howell, because
I'm
I do
going to ask her the same question,
that
but
they
both
do.
the Senate and the House.
Yeah, I mean, I think one thing that I'd like to share, and I think that we can celebrate as long as we, you know, have it in place, is that we have been building a bipartisan coalition of people who understand there is not a single legislator. You know, regardless of how they're voting, I think there's not a single legislator in the Capitol that does not understand what a huge economic blow this would be to our state. I mean, I just think that that is known. It's whether, you know, people vote the way they vote, but I do think that there's really is an understanding of that and how terrible it would be for every single one of their constituencies. But some people are still going to vote the way they do. But I think that we have in the Senate, we've been able to build a bipartisan coalition that, you know, I think really honors the kind of Montana way of life and Montana values that a lot of us, you know, are proud of. The parts of it that we're proud of, which, you know, are being moderate, being practical, listening to each other, and just, you know, coming up with solutions that are actually going to be not ideological, but are going to be good for their constituents. And so I feel good about what we're building, but you just, you know, you don't know until people vote. I am not going to count any chickens. But yeah, so I think that it's slow and steady and we can't take anything for granted.
Great. Thank you, Senator Neumann. You bring a very unique voice to the legislature, a voice that is invaluable to these discussions.
Thank you for having me.
So glad all of you are here. State Representative S.J. Howell is the Vice Chair of the House Human Services Committee of the Montana Legislature. Howell is the Executive Director of Catalyst Montana and has worked on previous successful campaign to pass Medicaid expansion and has managed 3 cycles of civic engagement with low-income women. Representative Howell.
Thanks so much, Terry. Really glad to be here with everyone. Tough acts to follow from these other speakers, but what I'm going to do, you know, we've heard a lot about how important this program is, how it's so interwoven into our lives and the lives of our family, friends, and neighbors. I'm going to talk a little bit about what's happening in the legislature right now, what we are seeing, bills that are moving, and what we should be anticipating. So just really briefly, you know, we've mentioned past efforts. You know, the Montana State Legislature first took up Medicaid expansion in 2013 with a compromise bill. It was more of a Frankenstein bill, really, that ended up not passing. We came back in the 2015 session and really took the interim, the 18 months between the sessions, to do a lot of organizing work, a lot of work pulling in all of the medical professionals and the advocates and the community groups and, you know, all of the kind of stakeholders that are still such a big part of this conversation. And we built this, you know, big and broad and diverse set of voices calling for Medicaid expansion, and created what I think really was a sort of sense of inevitability. We went into the 2015 session with people saying, you know, Medicaid expansion is the top issue of the session, and it's not a question of if, but how we'll expand. And we did. The bill was definitely, it included compromise elements of the policies, but it expanded. It went into effect January 1st, 2016. And, you know, within 2 years, our unemployment rate in the state of Montana had dropped by 10%, had dropped in half. I mean, it was an unbelievable success. But of course, part of the 2015 legislation was a sunset, which meant that in the 2019 session, we had to come back and do it again. And, that session was tough. We ended up with, sort of additional compromises, which included policy elements like work requirements and premiums that were passed and are in current statute, but haven't been implemented because of restrictions and guardrails at the federal level. And once again, in 2019, there was a sunset. So that brings us to here. This is why we're here once again having this conversation in 2025. And I think that the core efforts, certainly from Democrats and advocates and many of the folks we're working with, is to lift the sunset, to stop the cycle and the instability, and to make this program permanent, and to ensure that we are really continuing our current program. So there's a bill, House Bill 245, that's sponsored by Representative Ed Buttrey, who also sponsored bills in 2015 and 2019. And House Bill 245 does just that. It lifts the sunset, it makes the program permanent, it continues our current program. That's all that House Bill 245 does. And in some ways, that's a really positive thing. It's positive that we are not looking at new additional compromises, new additional bad ideas from around the country to add onto our program. So, I would say first and foremost, our job is to pass House Bill 245. Today, it's actually great timing that we're having this conversation. We took the first step on that journey today. We passed House Bill 245 out of the House Human Services Committee. It had a pretty robust bipartisan vote, passed 14-7. A solid handful of Republicans joining the Democrats in sending that to the floor. So that's really exciting. We should see that bill come up on the floor soon-ish. I wish I could tell you exactly when, but I don't know. But I would say that right now is the time to start calling legislators in the House in particular and saying, I hope you vote yes for House Bill 245 on the floor. I would say that, we feel fairly confident that we have the votes on the floor, but we also want to make sure that we are reminding legislators that Montanans are watching and that Montanans understand just how important this program is. There are a couple other bills that I want to highlight, in terms of good bills. So as I said, House Bill 245, it does the job. It continues the program, but we want to improve the program. We want to do some better things. So in the coming weeks, we're going to be bringing bills to add back in continuous eligibility, which helps with some of the churn, people getting disenrolled and having to re-enroll. I don't have a bill number on that, but we should by next week, and we'll make sure that Big Sky 55 plus folks can send that out. We're also going to be bringing a bill that has elements of Representative Mary Cafero's bill that was unfortunately tabled today that will improve access to benefits. It requires better communication. It requires use of existing data to prevent people from having to fill out forms. It requires the department to deal with the long wait lines on the public assistance helpline. And it will reopen 10 offices of public assistance around the country. So that's another really exciting bill that will come in the next few weeks. There are also a couple of bad bills, and Senator Neumann has had to deal with those over on the Senate side. There's one from Senator Glimm and one from Senator Trebus. Both of those bills are really designed at ending the program. They go about it in different ways, but the goal and the intent is clear to end the program. So, what I would say is, in 2015 and in 2019, it was really, really important that, one, legislators felt like Montana was watching. Like they had to make a choice, and they were going to have that, not just their constituents, but Montanans from across the state paying attention and weighing in on what was happening. And it's really helpful when folks like Dr. Wilson and folks like Cherie get involved and tell their stories. And also the voices of everyday Montanans from across the state are crucial. So whatever you can do to add your voice, the switchboard number is 406-444-4800. I have that number programmed in my phone. You can call every day. It's very nice switchboard ladies. You don't have to talk to a legislator. You just leave a message. It's a great way to share your voice. I know I'm about at time, but I do just really quickly want to address some of the concerns about federal issues, I guess I'll say. We are concerned. We're concerned about what happened today with the announcement of a freeze of federal grants and programs. We're concerned about possibilities of changes to Medicaid funding. What I'll say is this: changes to federal Medicaid law, for instance, that would have work requirements, that would make work requirements acceptable, or changes to our funding structure, such as moving to block grants, those have to be passed through Congress. They can't legally be done by executive order. So that's a benefit. And one thing that we should be doing is also communicating with our congressional delegation. For all the same reasons that we need legislators to hear from us, we need our congressional delegation to hear from us. And we should be pushing back against stunts like what happened today, and making sure people understand that playing politics with people's lives is absolutely unacceptable. I think these programs are deeply popular and for so many good reasons. And we just have to make sure that decision makers at every level are hearing from us about that. So I'll stop there and happy to answer questions.
Great. Thank you so much. And thank you for that brief history. It's really important to hear what a struggle this has been and how positive it's been to pass it. And, we've heard such great stories about how it's affected people's lives. So what do you think the key was to passing Medicaid expansion in the first place? And can some of that be duplicated this session, or is it a way different session?
It's a great question. There are some key differences, but I think that fundamentally our work remains the same. It's about a lot of people making their voices heard, making phone calls, sending emails. It's about sharing personal stories. It's about folks showing up to the Capitol when you can, for hearings, to talk directly to legislators in the hallways, things like that. And I think, again, it's about making sure that we piece together a bigger picture for legislators of how we really can't do without this program. Whatever it is that a legislator cares about, and every legislator has their own interests, their own passions, and I can almost guarantee whatever it is that a legislator cares about, Medicaid matters to that. And so we just have to find the way to share with all the legislators how this is really crucial and their vote matters. Cora, jump in.
Yeah, I'd be happy to weigh in on that too. I think that's exactly right. I think, like I said before, reiterating how this doesn't just benefit Medicaid, recipients. It really, losing rural hospitals. Where are you going to go if you have a heart attack? I mean, you can just thinking about, obviously personal stories are always really, really valuable. So if you have anything that you can share as to your legislator as their constituent, I love the action alerts that groups like Big Sky 55 Plus do. You make it so easy. What I would say as a legislator, and I'm again just starting off here, but I do, it does catch my eye. We get a lot. It does catch my eye if you add something personal. And even if it is, if you are in our district, to say I'm one of your constituents in your district and share something personal, I think that is helpful. And it just, takes a few extra minutes, but I think that can make an impact. And I think, talk about the economic impact. I think it's, 60% of small businesses have people enrolled in Medicaid, right? So what is it that you think the legislator cares most about? And then we can, I mean, we can provide, you know, talking points. I'm sure you have everything you need. Big Sky 55 Plus has everything, but, you know, just kind of think about how to say, not just, we can't get rid of this, it will be a disaster, more like my, you know, friend runs or I run a small business and, you know, we rely on Medicaid at times, or even if there's no personal story, just something that you feel like you can link beyond just Medicaid recipients, if that makes sense. I think that is helpful.
Great. And for either of you, how about what's the impact on seniors and rest homes of Medicaid, the current Medicaid that we have now?
Yeah, that's a great question. So the Medicaid expansion population only goes up to age 65. So, you know, folks definitely between, say, 55 and 65 can and are covered by Medicaid expansion. Most folks who are covered by Medicaid and in nursing homes are on sort of a different type of Medicaid, traditional Medicaid. But what I will say is the ability for our healthcare infrastructure, including nursing homes, to continue to operate really depends on expansion. And some of the efforts to improve Medicaid, you know, I talked a little bit about improving the access and the customer service. That would be, I think, a big benefit for seniors and folks receiving nursing care. I certainly heard during the interim an awful lot of heartbreaking stories about folks whose nursing homes were closing, who are being moved hundreds of miles away from their families, folks who were working in nursing homes who were laying people off and losing their jobs, all because of challenges with the redetermination process and with getting access to Medicaid. So, you know, as in life, all of this stuff is connected. There's no, you know, no real standalone issue. I think there's a couple different ways that continuing Medicaid expansion and improving the program overall would help benefit seniors and nursing homes.
Great. Thank you so much, Representative Howell. Big Sky 55 Plus has enjoyed working with Montana Women Vote and Montana Human Rights Network and now Catalyst. So we look forward to much success together. They're great partners. Thank you, Cherie, Lauren, Cora, and Howell. What a great town hall meeting. We are so grateful for your passion, expertise, and leadership in keeping Montanans healthy by lifting the sunset on Montana Medicaid and working for affordable health care for us all. We're about to wrap up. I'd like to have our fabulous Big Sky 55 Plus lobbyist and executive director, Margie McDonald, talk a little bit about how easy it is to contact your legislator in response to our email calls to action. Margie.
Okay, thank you, everyone. And I am going to try and get to the right screen here. There. So what I want to walk you through, we've had some good questions from people about how can I reach out on a timely basis and get to those lawmakers who need to hear from their constituents or from the wider state. And I think when it comes to these bills on Medicaid, I think it's perfectly legitimate and important to do a broad approach. But when the bill is in committee, we will help you reach the committee members, and when it's coming to the floor, we have a different strategy for that. And so I'm going to walk you through what that looks like. If you should all be signed up for our email system, and you'll get an action alert on an issue. Today we issued one on property tax relief, and I just want to walk you through how that works.
Can I jump in, Margie? So if I'm sorry, if we're signed up for your emails, will we also get those, or do you need a separate action alert?
No, you should be getting those.
Okay,
so
just to clarify, thanks.
So you'll scroll down, and it will also be sometimes in our weekly bulletin, there will be a thing, click here to send a message to your legislator after an article. And then it'll bounce you over to a page where there's a little briefing on the background of the issue, gives you some additional talking points and some broader perspective. And then it gives an opportunity to take action, and you enter your address. And I'll just go down and do the one on Medicaid, although this one is a little dated because it still has House Bill 230 and And in this one, House Bill 245 was still in committee, so I won't
Margie, sorry to interrupt, you'll need to share the different, a different screen. We're still seeing your email.
Oh,
So it
okay.
didn't automatically, you may need to unshare and reshare. I'm not sure the best way to do it.
Oh, okay. Let me try that again. Does this one work?
That's only showing the email. So you may need to
Okay.
share the
Oh, I see. When I transitioned over to our,
yeah, when you went to a different page, it stopped. It didn't
I
share what.
got, okay, slow learner here. So now we are on the page where you've hit that little button
That's
and it
working.
takes you to the background. Can you see now?
Yes.
Takes you onto our website. You get a little kind of background briefing on the issue. And we'll just pretend that we're going to send this one, although it's a little out of date. So we're going to update it and have a different one for you tomorrow. But you put in your address. Oops. And anyway, and your zip. And then you hit go and presto, it takes you to a page where if you scroll down, you have both the briefing, and because I didn't type the address right, it doesn't give me that, but you fill in your contact information. And then you look at the committee. This was for a message to the Health and Human Services Committee that voted for the bill today. So you can see if, let's say you decided that, I wouldn't advise this, but let's just say you decided not to send one to the Speaker of the House, Representative Brandon Lehr. For some reason, you can kind of tailor who you're going to send to. And then you fill in the information and you hit send. And then, which I hadn't done, but down below, you will have the opportunity to change the heading. You might want to tweak it a bit so that it's not the same heading that everyone else sends. And this is where you can put in your personal story. You can actually tailor your message before you send it. And then all the rest is done. It goes to the specific lawmakers. We will have one for you within the next 12 to 24 hours that allows you to send it to the whole committee, to the whole House Committee of the whole House of Representatives on House Bill 245, which is very exciting that we have this opportunity for you to engage with that. Any questions?
Thank you, Margie. Thanks to everyone for being with us tonight. As Joan Baez said, action is the antidote to despair. Big Sky 55 Plus gives us the antidote to despair. Accurate, timely information and the tools to take action for the common good together. Please tune in for our next town hall, Tuesday, February 25th at 6 o'clock. We'll focus on the third branch of government, our independent judiciary, and the attacks coming from the legislative and executive branches on our independence. In the meantime, we look forward to working with you as we use our superpowers to support healthy futures, saving Montana Medicaid. Thank you so much again to the panelists. You were fabulous. Thanks to everybody for being with us tonight, and go fight win.